measuring a structural leg length discrepancy, you're going to go from ASIS down. It says from medial, you can measure to the medial or lateral malleoli. I like going to the medial malleoli just because the lateral malleoli, as you invert your foot, you get some inferior translation, or as you evert it, you'll get some superior migration of the fibula, so that landmark can shift and change a little bit. So I like going just to the medial malleoli. So for measuring structural leg length, also finding the ASIS, one thing that, you know, we were getting a lot of variability in the measurements. And one thing I like to do with the ASIS is I like to hook underneath the ASIS, because it's a flat bone, so you don't necessarily know if you're measuring from the top of it, from the bottom of it. So I generally, when I go for the ASIS, I hook underneath, okay? And that'll be my starting spot. So I know I'm at the most distal aspect of the ASIS, and it doesn't change my measurement. And so then I'll come down and I will measure to the most inferior aspect of her medial malleoli. Again, I won't measure in the middle of it or the top of it. I'll measure to the most inferior aspect of her medial malleoli. And then I'll compare that side to side. Again, a normal difference is anywhere from 1/2 to 1 inch, okay? Anything greater than that, I'm probably gonna put, you know, a heel lift or something in there. One thing to note with this as well too, you can get a leg length discrepancy that's not congenital, but post-surgical. So hip replacements, knee replacements, sometimes they'll come out with one leg a little bit longer than the other. Generally, surgeons will wait like 6 months. They'll say, let's let the hip settle, see where its final position is. But sometimes you can get a leg lift discrepancy post-op as well too. So I would keep that in the back of your mind that you can have a leg lift discrepancy post-op.